There's a lot of conversation right now around calls regarding mental health, especially those older adults who may be suffering from Alzheimer's or dementia. Officers and deputies are oftentimes placed in situations that are, for a normal person, would be very difficult to determine what's the best way forward and how to manage and resolve a whole host of different types of scenarios. What kind of training do they go through to help them prepare for that?
So, we do a lot of training, and training that we haven't done, not just tactical training, but decision-making training. We have simulators that will simulate a critical incident where it's like a big video and, do you shoot, do you not shoot, how do you handle the situation? And we do a lot of the scenarios, but also really critiquing responses. We've also started doing things like mindfulness training that really, really helps our deputies with the mindset. Certainly de-escalation. We at the Sheriff's Office actually run the Regional Police Academy here, and we're always making modifications, obviously meeting state standards, but making modifications for what do staff need. Many years ago, I'm thinking maybe 5 years ago now, we started training the crisis intervention training in the academy. It's a 40-hour block of training on how to deal with mental health. Certainly that is a big issue. I'm also extremely excited that I've been proposing this for years, is that, and we'll be doing it in the communities you represent, we will have a deputy assigned in a car with a clinician, and they will respond to calls for mental health, because the clinician brings another dimension, and also the clinician will have access to the person's medical records, the mental health records. They'll know resources, they'll know much more about it than we do. We'll still have all the criminal databases, but they'll have all the mental health databases. And I think that's going to be really effective. And we've actually selected the clinicians, and it's a program that'll be starting soon. And some other agencies will be doing it also, but I think that we might be one of the first. People with mental health issues do not belong in jail, but the percentage of people with mental health issues in the jail is tremendous. And they committed a crime, allegedly, but very often that crime is a result of their mental illness, whether it's an assault or a theft. This county also has a real aggressive mental health court that really treats the person, not just the crime. So I think that Santa Clara County is always a leader in areas, and I'm really excited about getting these mental health teams on the streets answering calls with mental health.